If you clicked on this video hoping I'm about to hand you a magic exercise, a pill, or a stretching routine that will permanently add inches to your penis, I want you to stay anyway, because what I'm going to tell you over the next 20 minutes is more valuable than any of that, and it might be the most important video you watch this year on this topic. I'm going to talk to you the way I talk to patients in my clinic, honestly, without selling you anything, and without wasting your time. My name doesn't matter as much as my training does. I'm a urologist. I've spent years in medical school, years in residency, and years afterwards seeing real men in real exam rooms with real concerns about this exact topic. And I can tell you with complete confidence that the question, how do I make my penis longer, is one of the most common things men ask a urologist, and almost nothing they've read online about it is true. So let's start with the truth, because you deserve it. There is currently no scientifically validated, medically endorsed method that permanently increases the length of a flaccid or erect penis in a healthy adult man, outside of surgery, and even surgery comes with serious limitations and risks I'll explain shortly. Pills don't do it. Pumps don't permanently do it. Most stretching devices don't do it in any meaningful, lasting way for the vast majority of men. I know that's not the answer the title promised, and I know some of you are already reaching for the back button, but please don't, because what I'm about to explain will save you money, protect you from injury, and more importantly, it might change the way you think about this entire issue, which, in my professional opinion, is rarely actually about centimeters. Let's talk anatomy first, because you can't understand this topic without understanding what you're actually working with. The penis is made up of three main chambers of erectile tissue. Two of them, called the corpora cavernosa, run along the top, and one, called the corpus spongiosum, surrounds the urethra underneath. When you become aroused, blood flow increases into these chambers, they expand, and the tissue becomes rigid. This is what we call an erection. The size of these chambers, their length, and their capacity to expand is determined very early, largely during fetal development and puberty, influenced by genetics and hormone exposure, particularly testosterone, during specific developmental windows. Once you're a fully grown adult, that basic architecture is essentially fixed. The tissue doesn't have some untapped reservoir waiting to be unlocked by a few weeks of exercises. This isn't a muscle you can train like a bicep. There's no clinical mechanism by which stretching skin or tugging on tissue for a few minutes a day rewires that fundamental anatomy in a way that adds permanent erect length. Now, I want to address something important because this is where most of the confusion in the industry comes from, intentionally. There's a difference between something that creates a temporary illusion of size, something that may stretch tissue very slightly under extreme and prolonged mechanical tension, the way certain tribal practices used in body modification have done over many months with heavy weights, causing tissue damage and stretching, and something that is safe, healthy, evidence-based, and recommended by medical professionals. Almost every product marketed to you, the pills, the so-called natural enlargement supplements, the vacuum pumps sold for permanent gain, the extender devices sold without medical supervision, falls into a gray zone where the company shows you a testimonial, shows you a stock photo of a measuring tape, and lets your own hope do the rest of the persuading. That is not science. That is marketing dressed up as medicine. Let's go through what is actually out there, one category at a time, so you understand exactly why I'm telling you this. First, pills and supplements. There is no oral supplement, no herbal pill, no vitamin combination on the market today that has been shown in controlled clinical trials to increase penile length. What these pills can sometimes do, the ones that aren't pure placebo, is contain ingredients similar to what's found in erectile dysfunction medications, things that increase blood flow temporarily, which might make an erection feel firmer or fuller in the moment. That is not the same as permanent growth. It is not even close. Many of these supplements are entirely unregulated, meaning the company can put almost anything in that bottle, and some independent lab testing over the years has found contamination, undisclosed pharmaceutical ingredients, and in some cases, substances that can be dangerous when combined with certain medications, especially heart medications or nitrates. If you are currently taking one of these supplements, I'd encourage you to check the actual ingredient panel and consider discussing it with your doctor, especially if you take blood pressure medication. Second, traction devices and extenders. This is actually one of the more scientifically interesting areas because there is real published research here though it's limited and the results are modest. Penile traction therapy, where a medical device applies gentle, constant tension to the penis for several hours a day over a period of months, has been studied primarily in men recovering from Peyronie's disease, which is a condition involving curvature and scarring of the penis, or in men recovering from certain pelvic surgeries like prostatectomy, where the goal is to prevent tissue shortening and preserve function, not to enhance length beyond a person's natural baseline. In those specific clinical contexts under medical supervision, with a properly fitted device, some studies have shown small length improvements, often in the range of half a centimeter to a little over a centimeter after consistent daily use over several months. That's it. That is the most generous, most clinically grounded data we have, and it applies to a specific patient population, using a clinical device for many hours a day, every day for months, often as part of recovery from a medical condition, not as a casual at-home enlargement hack for a healthy man watching a video at midnight. The devices sold online for general enlargement are rarely the same quality, rarely used under supervision, and the results in healthy men without an underlying condition are far less reliable, if they exist at all. Third, vacuum pumps. These create negative pressure around the penis, drawing blood into the tissue and creating a temporary engorged, larger-appearing erection. Some men use these as a tool to help with erectile dysfunction, and there is legitimate medical use for them in that context, under guidance, as part of penile rehabilitation after certain surgeries. But the size increase from a pump is temporary swelling, not tissue growth. The moment that pressure is released, the tissue returns to its baseline size over a short period of time. Overuse or improper use of pumps can cause bruising, burst blood vessels, tissue damage, and in some cases, can actually contribute to erectile dysfunction over time, rather than improving it. This is a tool with a narrow, supervised medical purpose, not a casual enlargement device. Fourth, jelqing and manual stretching exercises. This is the category I get the most questions about because it's free, it's popular on forums, and it feels like something within your control. Jelqing involves a milking motion along a partially erect penis, repeated for sets, supposedly to push blood into the tissue and stretch it over time. I want to be direct with you. There is no quality clinical research supporting jelqing as an effective method for permanent length increase. The mechanism proposed for why it might work isn't well supported by what we understand about erectile tissue physiology. What I have seen in clinic are men who have injured themselves doing this. Micro tears in tissue, bruising, scar tissue formation, and in some unfortunate cases, the early stages of something called penile fibrosis, which is hardened scar tissue that can actually cause curvature, pain, and in irony that should concern you, can sometimes make the penis look or function worse, not better. If you are currently doing this and have noticed lumps, hard patches, pain, or curvature that wasn't there before, please see a urologist. That's not something to wait out. Fifth, and this is important, surgical options. Yes, there are surgical procedures marketed for penile lengthening, and yes, surgeons do perform them. But I need you to understand what these procedures actually do and don't do, because the marketing around surgical enlargement is some of the most misleading in all of cosmetic medicine. The most common surgical approach involves cutting the suspensory ligament, the ligament that anchors the base of the penis to the pelvic bone. Cutting this ligament allows the portion of the penis that is normally tucked up inside the body to drop down and be more externally visible. This can create the appearance of a small amount of additional flaccid length, typically a centimeter or two at most, but it does not add new tissue, and critically, it often does very little for erect length, because once you're erect, that ligament was providing structural support and stability. Many surgeons who specialize in this area, including respected voices in urology and sexual medicine, have spoken publicly about disappointing outcomes from this procedure. Instability of the erection, where the penis may wobble or point in unexpected directions during intercourse because that supportive ligament is gone, scarring, infection risk, and in a meaningful number of cases, patient dissatisfaction even after the surgery was technically successful because the actual visual or functional change was smaller than they had imagined, and they had imagined a lot because they'd seen the same marketing you may have seen. There are also fat grafting and dermal filler injection procedures that increase girth, not length. by adding volume around the shaft. These come with their own risks, including lumpiness, asymmetry, infection, and in rare but documented cases, fat embolism, which is a serious medical emergency. The major urological associations, including the American Urological Association, do not endorse cosmetic penile lengthening surgery for men with normal anatomy, and generally reserve surgical intervention for men with a verified medical condition, such as a confirmed diagnosis of micropenis, severe Peyronie's disease, or reconstruction after trauma or cancer treatment. Now, let's talk about something I think matters more than anything I've said so far, and it's the part of this conversation that almost nobody on the internet wants to have with you because it doesn't sell pills or extenders. It's the psychological side of this question. In clinical sexual medicine, there's a recognized phenomenon called penile dysmorphic disorder, which is closely related to body dysmorphic disorder. This is a real, diagnosable, treatable condition where a man becomes preoccupied with the belief that his penis is too small, often despite being entirely within normal anatomical range, sometimes despite being above average, and this preoccupation causes genuine distress, avoidance of intimacy, anxiety, and in some cases, depression. Studies on male anatomy have repeatedly shown something that surprises a lot of men. Most men significantly underestimate where they fall in the normal range, and most men's perception of average is skewed by pornography, by locker room exaggeration, by a culture that has turned a private anatomical detail into a public measure of masculinity, worth, and confidence. The most commonly cited research on flaccid and erect length, gathered across thousands of men using actual clinical measurement rather than self-report, consistently shows average erect length in the range of roughly 13 to 14 centimeters, around 5 to 5.5 inches, with the vast majority of men falling within a fairly narrow range around that average. Self-reported numbers online are almost always inflated, sometimes dramatically, because nobody is in the room checking, and that gap between what's real and what's claimed online has quietly fueled an entire industry of insecurity. Here is something I tell patients in clinic, and I mean it as a medical professional, not as someone trying to make you feel better with empty positivity. Sexual satisfaction, both your own and your partner's, correlates far more strongly with confidence, communication, technique, emotional connection, and overall sexual health. Things like erectile function, stamina, and the absence of performance anxiety than it does with an extra centimeter of length. Multiple studies surveying partners about what matters most in sexual satisfaction consistently rank size far below other factors like attentiveness, communication, and emotional intimacy. I'm not telling you that to dismiss your concern, because I know it's a real concern for a lot of men watching this, and I respect that it's hard to talk about. I'm telling you because as your urologist, I would rather you spend your energy, your money, and your mental health on things that actually move the needle on your sexual well-being and your confidence, rather than pouring it into a $30 a month subscription for pills that do nothing or a device that might injure you, chasing a number that, statistically, is very likely already within a completely normal and functional range. So, what should you actually focus on, if not enlargement? Let me give you what I consider the real, evidence-based priorities for penile and sexual health, because there are genuinely things within your control that matter. Cardiovascular health is at the very top of this list, and I cannot overstate this. An erection is fundamentally a vascular event. It depends on healthy blood vessels being able to dilate and fill the erectile tissue efficiently. The same risk factors that damage the arteries around your heart, smoking, poorly controlled blood pressure, high cholesterol, obesity, sedentary living, also damage the small blood vessels in the penis, often years before you'd notice symptoms anywhere else. In fact, erectile dysfunction is sometimes one of the earliest warning signs of cardiovascular disease, showing up before chest pain or other symptoms, because the blood vessels in the penis are smaller and show damage sooner. If you want to protect and optimize your sexual function for the rest of your life, quitting smoking, managing your weight, controlling your blood pressure, and getting regular cardiovascular exercise will do more for your sex life over the next 30 years than any enlargement product ever could. Pelvic floor health matters too. The muscles at the base of your pelvis, particularly the bulbocavernosus and pubococcygeus muscles, play a real role in erectile rigidity and ejaculatory control. Pelvic floor exercises, often called Kegels, have actual clinical evidence supporting their use in men with erectile dysfunction and premature ejaculation. This won't make you longer, but it can genuinely improve firmness, control, and confidence during sex, which circles back to what actually drives satisfaction. Hormonal health is worth getting checked if you have concerns. Low testosterone can affect libido, energy, and erectile function. This is something a simple blood test through your doctor can evaluate, and if it's genuinely low, there are legitimate medical treatments under supervision that can help. This is different from the testosterone-boosting supplements sold online, most of which contain doses or ingredients that do very little. Mental health deserves real attention here too. Performance anxiety is one of the most common causes of situational erectile difficulty in younger, otherwise healthy men, and it's a self-reinforcing cycle. You worry about size or performance, that worry itself interferes with arousal and erectile quality, which then reinforces the original worry. Breaking that cycle sometimes means talking to a therapist, sometimes means open communication with a partner, and almost always means stepping back from the comparison culture that social media and certain corners of the internet have built around this topic. If, after all of this, you still have a genuine concern, not a passing insecurity, but a persistent, significant worry about your anatomy, here is what I actually want you to do. Talk to a urologist in person, not a forum, not a supplement company's customer service chat, not an anonymous review section. A real urologist can examine you, can tell you clearly whether you fall within normal anatomical range, can screen for any actual underlying conditions like Peyronie's disease or hormonal issues, and can have an honest conversation with you about realistic options, if any genuinely apply to your situation. Most men who have this conversation with an actual physician leave with enormous relief, not because the doctor handed them a magic solution, but because they finally got accurate information instead of marketing. I also want to say something directly to anyone watching this who is in a genuinely distressing place with this, where it's affecting your relationships, your self-esteem, or your daily mental health in a serious way. That distress is valid, and it deserves real support, not a $100 bottle of pills. Speaking with a licensed therapist, particularly one with experience in sexual health or body image, can make a meaningful difference. And there's no shame in that. This is a common struggle, more common than most men admit, and seeking help for it is a sign of strength, not weakness. Let me bring this all together, because I know this wasn't the video some of you expected when you clicked. There is no pill, no exercise routine, no pump, and no over-the-counter device that will safely and permanently increase the length of a healthy adult penis. The closest thing to legitimate evidence exists in narrow clinical traction therapy used for specific medical recovery situations, supervised by a physician, and even there, the gains are modest. Surgery exists, but it comes with real risks, real limitations, and outcomes that frequently disappoint patients who were sold an exaggerated picture. The industry built around this insecurity is enormous, profitable, and largely unregulated, and it thrives specifically because this is a topic men are too embarrassed to fact-check with an actual doctor. My goal with this video was to be that fact-check. What I want you to walk away with isn't disappointment. I want you to walk away with relief, and with a redirected sense of where your energy actually belongs. Take care of your cardiovascular system. Move your body. Don't smoke. Get your blood pressure and cholesterol checked. Strengthen your pelvic floor. Address performance anxiety instead of avoiding it. Talk to a real doctor if something feels genuinely abnormal, rather than guessing based on what you've seen online. And give yourself permission to let go of a number that, statistically, is very likely already completely normal, and that has never been the actual foundation of a satisfying, connected sex life. If this video gave you the honest answer you weren't getting anywhere else, consider sharing it with someone who needs to hear it, because I promise you, there's a man in your life right now, quietly spending money on something that doesn't work, too embarrassed to ask the question out loud. Be the friend who sends him this instead. Take care of your health, listen to your body, and don't let an industry built on insecurity make decisions for you that your own doctor should be making with you. I'll see you in the next video.